Hello, good afternoon, and welcome to the NC Health Connex Town Hall. We're excited to share some information today about the new NC Health Connex Clinical Portal. Before we begin, I'd like to run through a few housekeeping items. Due to the limited amount of time allotted for this presentation, we will be putting everyone on mute. If you have questions, please utilize the chat feature within the WebEx. We would, however, appreciate you only asking questions that pertain to this presentation. Click on the chat icon shown in the red square, then type your question in the text box as shown in the red rectangle. We will try to address all questions at the end of the presentation. If you have questions specifically related to your practice or were not able to get to your questions today, please email the HIE Help Desk team at hiesupport@sas.com. and we will provide you with our contact information at the close of today's presentation. Please note this session is being recorded and will be posted to the NC HIEA Training and Tools webpage along with the PowerPoint presentation. Please be patient as this may take a few weeks. Over the next hour, we will cover the following topics. We'll have some introductions, and then Jessica Bremer will talk about use cases from various provider types, portal step-by-step demo, and the suite of services, and then we'll address your questions. So let's get started with some introductions. From the North Carolina Health Information Exchange Authority, we have Kelly McDonald, Business and Provider Relations Manager, Jessica Bremer, Business Development and Outreach Specialist. From the NC Health Connex SAS Help Desk, we have Arn Coda, Manager of the Technical Support Team, along with Terrence Atkinson, Josiah Berryman, and myself, Holly Elliott, all technical support analysts. And now I will turn the presentation over to Jessica Bremer, who will begin with an overview of sample use cases.
If this is a life-threatening emergency,
thanks, Holly.
Hang up and dial 911.
Today I'm going to provide you with some use cases throughout the presentation so you can begin to think of how your practice may use NC Health Connex. To start, I would like to share with you the facilities that are connected to NC Health Connex. As you may already know, our website is full of good and useful information. To see facilities that are connected to the HIE, you can visit hiea.nc.gov, and we have provided two types of tools for viewing connected facilities, a map of North Carolina as well as a table. Those have the same information as the list of participants is updated at the beginning of each month. So as you can see from the screen, if you go to our website, you can click on the home button located at the very top left hand of the screen. Scroll down to the bottom to the blue box, and you will see a box that says see who's connected. You can click on that box, which will take you to the map. And then at the bottom of the map, there's also another box where you can view it in a table format as well. All right, so there are two different ways to see clinical information in the portal. So one's going to be through the web-based portal where you can just initially just log on or type in a web address into your internet browser, and the other is going to be through your electronic health record if your EHR has the capability for NC Health Connex to sit inside. We are also in the process of having a successful connection with the bordering states. Therefore, if you have a new patient that shows up at your facility, but they have previously been seen in another state, you may be able to see their encounters, diagnosis, tests, allergies, medications, and more in NC Health Connex if the information was sent to the eHealth Exchange. Throughout this presentation, I will give you an overview of how each provider types listed have used or is currently using NC Health Connex. We recently reached out to our top users to understand how each provider type receives benefit, so let's start with sharing three use cases. An FQHC, Federally Qualified Health Center, stated that most of their inquiries occur after a patient office visit or a hospital stay and are done to ensure that order testing has been completed and quality reporting. The case manager stated, I use the portal to look up labs, test results, consult notes from other providers for quality reporting. This data is provided to insurance companies and other agencies. I also use it to see if the patient has changed practices or has seen specialists. It provides an accurate picture of where the patient has been in their healthcare journey while saving valuable time and research. For IDD providers, patients frequently receive services from different providers such as group home from one provider, day supports from another provider, and employment services from another. And small providers often shut down and the cases are transferred to other providers. So in short, you have multiple providers who need access to the exact same information about an individual. You have constant turnover, so new staff need to learn about the individuals all over again. And as the services continues into multiple years, providers need to be able to see what has been tried in the past and know what has worked versus what has not worked. They also stated by purchasing an electronic health record, it will increase accuracy of work and decrease billing errors and denials, which eliminates non-value added work. A county health department primarily use the portal to look up missing patient information. For example, their OB patients. They search for the patient in NC Health Connex prior to the appointment to see if they have initiated care elsewhere or have had an ultrasound through an emergency room. If they see prenatal lab panels, they may not repeat them. If they have had an ultrasound already, many times they can use this to more accurately date the patient's pregnancy. The ability of NC Health Connex to aid in reducing the duplication of testing such as blood tests and radiology tests, and to reduce the cost savings component could be in the hundreds of thousands of dollars just in the obstetrical work. All right, so now I'm going to give you a step-by-step demo of our clinical portal, and I do want to point out, so the clinical portal is used for viewing information only. A lot of times we will get calls where individuals think they can input information into the portal, but that is not correct. So the portal is only used for viewing the information. So I'm going to go ahead and log in. Okay, so just as with any user, you're going to have a username and password. So of course you're going to input your username and password into this screen. I do want to point out this is the demo environment, so all the patients that you see today, it is just fake information and fake patients. All right, so we ask that you always read the disclaimer. This will come up every time that you log in. So read the disclaimer, and then you may click agree. And so then it's going to bring you to the landing page. On the landing page or the home page, this is where you are going to see your recent patients. And so these are patients that you have searched previously. These are done in alphabetical order. So therefore, if like a provider sees 5 patients within 30 minutes and he needs to go back to patient number 2, but he can't really remember who he saw second, he'll just be able to look by the patient's name. On the left-hand side, you are able to look up a patient through your electronic medical record or your electronic health record ID number. However, if you do the ID number, you also have to click the drop-down and find your facility. So you would just find your facility so that way it will pull the correct patient. Below that, we have last name, first name, middle name, and date of birth. Make sure that when you are doing this, you at least put last name and first name. However, if I'm looking up a Jessica Bremer, it's going to pull up all Jessica Bremers. So if you can pull up Jessica Bremer and then also the date of birth, it's going to more accurately pull the correct individual. At the top of the screen, we have patient search, which is going to land you back on the page that you see right now. And then we have messages. Messages goes to the Direct Secure Messaging Center. This is where you are going to be able to send messages to any other provider that is also within our NC Health Connex directory, and I will show you how to get to that in just a second. So of course, when you click messages, you're going to be able to see messages in which you have crafted and sent to other providers. Just essentially like secure email. So if you're going out into your Outlook, it may look very similar. So you have the inbox, the sent, deleted, drafts, and then of course you can create folders just by clicking the green plus sign, and you can create the new folder, whereas you can see here I've created one that says referrals, and then you can move emails into different folders. If you would like to compose a message, you will essentially click compose. So once you click the compose button, it'll pull up a pop-up screen, and of course this is essentially going to look the same as email and Outlook. You are not able to type in a email address in the send to field. If you do click the send to button, it's actually going to pull up a screen, and on that screen it looks like I'm still having some issues even though I'm hardwired in. But once you click the send to button, it's going to pull up a screen, and within that screen you can search the provider directory. And then within that provider directory, you'll just click the person in which you would like to send an email to. So just remember, you can send a message to anyone that is within our directory. A future release is where you are going to be able to type in an email address within the send to field. And then of course you can put your subject and then your message in the notes section, and then you can attach any documents that you would like to attach to the bottom, and then essentially click send. All right, so then I'm going to go back to patient search. The next topic is going to be clinician tools. When I click clinician tools, this is where you are able to create lists to manage your patients. And so of course you can see I've been experimenting with the list. The first list that's going to populate is recent patients. And then if you click the list button, you can create additional lists. And so what you would do to do that is you just click the drop down and you can add or edit list. I have already created 2 lists already, and so you can just click the list, and then you can add patients to that list by clicking the green icon to the right. And then the next tab is going to be the Relationships tab. So in the Relationships tab, you're going to be able to have consulting, primary, and referring. So you are able to add patients to the relationship. And then you would just click the green icon and add the patient to the list. Then you would click on Patient Search, which is going to take you back to your home page or your main menu. And then, of course, My Account. That is just going to pull up information related to your account. And then, of course, Log Out is going to take you completely out. So going back to the patient search, of course, you can search by a patient name, last name, first name, or if it's in your recent patient section, you can just click the person that you would like to see information about. So you can click Jane Demo. And then that's going to pull up the individual in which you would like to see. So it's going to say, okay, this is the date of birth, this is the address, is this the correct person? You can click again. And if the system does not recognize a relationship between you and the patient, a patient-provider relationship, then it's going to ask you to break the seal or declare the patient relationship. Now, if your EHR has already sent information over to NC Health Connex, then the system will recognize that you have a patient-provider relationship. So in this case, I'm going to be able to click the drop-down, and I'm going to say I'm a clinician treating this patient. I'm going to declare the relationship. This is then going to take you into the patient information section. So you're going to land on the summary page. Within the summary page, you're going to see allergies, medications, diagnosis, documents, as well as general lab results, other results, and notes. I do want to point out at the very top is going to be your demographic information. If you scroll over to the right, you are going to see some icons. If you hover over those icons, you'll see exactly what each icon means. So, of course, this one here is going to show you that this patient has abnormal results, an alias name, ongoing patient alert, patient demographic, and then the patient has allergies. And I just want to point out the reason why you see that this patient has an ongoing patient alert is because I've added them into a list within the clinician tools section. If you want to go into one of the sections, such as the diagnosis section, and you need more details, if more details is provided, you can click the blue circle, and it will provide more details to you. Moving down to the Allergies and Alerts tab, you'll be able to see all the allergies and adverse reactions, as well as patient alerts. And then to see more information or more details, you would be able to click the blue circle, and it will provide more information to you. The Encounters tab is going to show you everywhere your patient has been seen or has had an encounter. And so you can see here Roanoke, Ahoskie, and then you can also see the attending physician. Then we have the Medications tab, where you have recent medications as well as historical medications. I had a question 2 weeks ago where a provider asked if they had prescribed a medication, the patient had not gone to fill the medication yet, but then went to a cardiologist. The cardiologist marked the medication as complete. Then how would it be shown in the clinical portal? And so the answer to that question is you could see it both places, because you have one provider who says that the patient should be taking the medication, and then you have another provider who had marked the medication as complete. So what you see mostly is accurate, but you may just want to follow up with your patient in a scenario like that. But to receive more information regarding the medication, you can click the details, and then more information will populate there for you. And you will be able to see the order name, the dose, the route, and the start date of the medication. Then we move into the History tab with family, social, and medical history. And then a lot of our providers like the Conditions tab. And so this is going to show you the diagnosis, present illness, and then also past illness. And so we show information as we receive it from different facilities and different providers. So if a provider has a present illness marked in their system as a present illness, then it's going to show as a present illness. If another provider has it marked as a past illness, then you may see it in both locations. Then we have the Procedures and Results tab. So you've got the procedures, general lab results, other results, and notes. And I do want to point out to you that any abnormal results will show in red. And so then you're going to be able to click on the highlighted area, and it's going to bring up those values for you. We then have the Vaccinations tab. So of course it's going to give you the name, the dose, the drug route, and the start date. And for more details, you will click the blue icon. And then we have documents. So this is going to be like a continuity of care document or summary of care. So if you would like to view documents, you would be able to click on the summary, and you can always make this bigger, and then you can scroll through. I really like the table of contents, and this just kind of lays it out and how you see it in the portal, except it's just in one summary for you. The other good thing about this is if you would like to print this document, all you have to do is just open it like we did, and you can right-click it and click print. The last thing I would like to show you is the View Timeline. So this is going to show you patient encounters. So of course you are able to select certain encounters to view. And so you can see it's going to take you to the document section where this encounter has been documented. So you can select all or deselect all. All right, so some use cases for the clinical portal. We have a lot of chiropractors who have stated that they like to use the procedures tab, and this is where they can go in prior to seeing the patient and see any x-rays or procedures that the patient had recently had. Within the Encounters tab, when reaching out to the top users, we had a community health center provider. She stated, "I was able to confirm that a patient of mine who had several outstanding referrals to different care organizations had not rescheduled her appointments as planned. This saved time for me and the medical record staff from having to log into 3 separate EHR systems to get the same information." Within the Conditions tab, the same provider stated, "I had a request from a mother for a note to let her son return to daycare after he had been seen at the emergency room for shoulder pain." She stated that we do not have access to the hospital EHR system for that particular emergency room, so I looked it up on the portal, and under the Conditions and Documents tab, I saw the diagnosis was actually a clavicle fracture and was able to do some critical follow-up to make sure the child would be safe before returning back to daycare. So, of course, she was able to go on to the Conditions tab. It showed that the patient had a clavicle fracture, and then she was able to go into the Documents section and then see notes where the physician had documented about that particular encounter. So for skilled nursing facilities, they like to use the Medications tab, and so they primarily use the portal to confirm the plan of care. So with the Medications tab, patients can receive the wrong medication or the wrong dose. So, of course, going to the medication, making sure they're giving the correct medication as well as the dose. They also use the Documents tab. And one of the skilled nursing facilities stated that some healthcare providers do not get accurate information about how long to leave in a urinary catheter or intravenous line. And then also, newsmedical.net published an article that talked about gaps in communication between hospitals and home health care providers that could lead to deadly medical errors. Within the study, home health care providers were able to electronically access notes, orders, lab, and radiology results, as well as referrals. And I already mentioned before that you are able to print the documents. I also want to point out that at the very top of the screen, so when you're in a patient record, you can click View Summary. And it's just another way for viewing the patient information. So there are 3 different ways that you can view the information. One is through CCD, the other is through HTML, and then, of course, the PDF patient summary. And so you can always send this patient summary through the Message Center by being able to click Send. However, if you have a provider that is not connected to NC Health Connex, but you need to get the information to them, you are able to print the document and send the information over that way. All right, and then I'm going to go back to Viewer, and just because I am done with my session, I'm always going to make sure that I log out. And that's just going to take you back to the login screen. I'm going to switch screens back to my PowerPoint. So as you can see, there are a lot of benefits by having access to the clinical portal. So being able to access a patient's data across multiple care settings over time enables effective coordination that increases quality, efficiency, and access of care. So those examples that you saw, some include medication list, drugs that may interact with one another, reduction in duplicate testing, being notified of allergic reactions, last immunizations, and also being notified of where your patient has touched the health system. So how do you gain access to the clinical portal? Reach out to your participant account administrator. If you are the PAA, you can go to our website under the For Providers, then Need Technical Support, and you can reach out to our staff help desk. And so the email address is provided there for you, as well as their phone number, and they will be able to help you gain access to the clinical portal. Now that you have seen the portal, I'm going to share with you the additional services that you are able to utilize and how to gain access to each service. Remember, the state does not charge for any of our services. Direct Secure Message, or DSM, is essentially the same as a secure email where you can send PHI to any provider that also has a DSM address within our NC Health Connex directory. I do want to point out to you that NC Health Connex, we are not able to ingest any information regarding this 42 CFR Part 2, so you are not allowed to send that information over to NC Health Connex. However, if you have a provider that needs that information with the consent of the patient, you are able to send Part 2 information through DSM. To use DSM, you must have a fully executed participation agreement and a portal account. To clarify, what you see on the screen is DSM through our web-based portal, not through your electronic health record. If you have a DSM account through your electronic health record, you can still use that DSM address. So a use case that we heard from some of our top users, a family physician uses DSM to communicate with other providers, and they actually take the documents they receive and they upload it into their electronic health record. And then a large health system that we work with stated that they receive benefit as there is no cost associated with direct messaging. And how do you gain access to a DSM account? You can reach out to your PAA at your facility, who will reach out to our SASC help desk, and they will be able to provide a DSM address for you. For providers who are prescribing opioids and will need to meet the STOP Act requirement, NC Health Connex will be able to help. Currently, providers have to log on to the CSRS database to pull the report on their patient to meet the STOP Act requirement. With NC Health Connex, CSRS will be integrated, so if you search a patient and you are prescribing an opioid, you will be able to pull the report from CSRS within our portal without having to log on to a separate system. You can enroll in CSRS by going to our website, clicking on the Services tab, and then you will see a blue box called Controlled Substance Reporting System Migration, and then you will follow the steps to enroll. Now moving on to notifications. So we heard from a couple of providers the challenges that they were seeing within the workplace. One was not knowing where their patients received care outside of their organization or outside of their electronic health record. Also, limited patient search capability within the clinical portal. So having a provider take a step away from the patient to specifically log in to search for that patient, it just took time away from the patient. And then, of course, those providers, they were not being notified in a timely manner where their patient had touched the health system. So because of those challenges mentioned, we provide an event notification service called NC Notify. This event notification service provides significant insight into a patient's health care across North Carolina. NC Notify is a subscription-based service that notifies providers as their patients receive services across the care continuum, spanning geography, healthcare systems, acute and ambulatory care settings, as well as other healthcare facilities. So the way that NC Notify works is, of course, you have to enroll into NC Notify. You will have to send us a patient file in which you want to receive alerts on. So once we receive that patient file, we scan NC Health Connex, and then we provide that file back to you. That file can be provided to you daily, weekly, monthly, or quarterly. And then whatever you decide to do with that file is entirely up to you. So if you would like to take that file and put into your electronic system so a case manager can reach back out, follow up with that patient, you're able to do that. I wanted to show you the roadmap of NC Notify and also point out for those facilities that are going to attest to becoming a Tier 3 advanced medical home, Having NC Notify will help you meet one of the requirements for Tier 3, and that's so that you can monitor your patients through an ADT feed. And I want to go through with you the version. So we have version 1 through 4, which is from October of 2018 all the way through October of 2020. So you're going to start seeing more things within the NC Notify alerts. So currently we have the format of sending or receiving the alerts as through a secure FTP or direct secure message. And then I want to point out at the very bottom, the content, you're able to see basic visit details such as the date, the visit type, and the location. And then at the end of this month, you're going to start seeing the chief complaint and diagnosis. And then moving out to October of 2020, you're going to start seeing those smart notifications. As you can see, the three main benefits of having access to patient alerts is being notified of where your patient has received care, reducing avoidable readmissions, and achieving financial goals. Reviewing the use case that I mentioned earlier about the provider from a community health center being able to search the patient in NC Health Connex to realize that the patient had a clavicle fracture instead of a shoulder issue when diagnosed at another facility. The provider stated, "These are just individual providers using the portal, but as you know, with services like NC Notify, the entire care team can have much needed information to keep patients safe during the riskiest times when they transition between one care entity and another." A large health system uses NC Notify for their PACE participants, high-risk inpatient discharges, active chemo patients, as well as their heart failure patients. And then another use case is from a primary care facility who tracks their diabetic patients with renal manifestations. So to enroll in NC Notify, you'll go to our website, click the Services tab, and then the green box that says Notification Service. Once you click that, it's going to bring you to some additional boxes that talks about the benefits of NC Notify, how does it work, as well as frequently asked questions, and then the enrollment form. So you do have to have a full participation agreement. You must complete the enrollment form. You will send us your patient list and then let us know how you would like to receive that list back. So is it going to be through the secure FTP or direct secure message? And then also, would you like to receive that list daily, weekly, monthly, or quarterly? All right, and then for our last slide before we get into any of the questions is the population health and analytics. So we are going to be integrated with some of the registries such as the diabetes registry and the immunization registry, and then future possibilities of the stroke and asthma. And then we already spoke about the controlled substance reporting system, and then the future possibilities of the electronic clinical quality measures. So specific benefits from a large health system include less connections or contracts for state-led initiatives, such as the immunization registry, the state health plan ADT data submission, electronic lab reporting, and then a conduit for future state reporting requirements. And they also stated the longitudinal record helps physicians not have to pull over individual documents to see a good picture of the patient. And the last use case of today's presentation is from a pediatric facility. They generally utilize NC Health Connex for continuity of care due to post-hospitalization, post-ED visit discharges, and data gathering for closing care gaps for their ACO, insurance payer programs, and Medicaid meaningful use quality measure reporting. I want to mention that there are additional slides to this slide deck from the previous Teletown Hall. I'm not going through those slides today, but I'll be happy to send those out so that you can review.
Okay, thank you, Jessica. Our contact information, thank you all for joining. We're going to open it up to questions now. I see that several have come in. Please keep in mind if your question is related specifically to your practice, we'd appreciate you sending an email to hiesupport@sas.com. If need be, we'll put you in touch with someone at the authority if we're not able to address that question. And now, questions? Let's take a look at your questions. Hello, we see a lot of you have questions about your EHR and your connection. Send us an email to hiesupport@sas.com so we can talk with you directly about your type of connection. They vary, depends on the type, whether bidirectional or not. And then again, those of you who are asking for portal credentials, of course, you can reach out to us as well. Hi, there was a question about privacy for patients and perhaps clinicians looking at patient information that they should not be. Please keep in mind that any time a clinician clicks on a patient, that view is audited. If a physician or clinician doesn't have a direct relationship with the patient based on their relationship with the facility, they will be required to break the seal, and those are audited, and we track them, and certainly if there are an unusual amount of them, that we would take note. Also, if you have a patient who does not want to be part of the NC Health Connex viewing, they can opt out, and there is information about the opt-out practice on the North Carolina Health Information Exchange Authority website. You can also contact the help desk for more information. Some of you are asking about why you might not see your patient data displayed in the portal. It could be that you're not live connected with the portal. It also might be that you're either not live or we're not getting the data. So I would recommend if you expect to be seeing something and it's not there, contact the help desk so that we can help troubleshoot the issue. Please keep in mind that we do not want you to send PHI through the ticketing system. If there is patient information we need to collect from you, we can do so over the phone, or if you have direct secure messaging, we can communicate that way.
All right, so I had one question that asked why I was using Internet Explorer. So you can actually use any internet browser with the clinical portal, so whether it be Firefox, Google Chrome, or Internet Explorer. So we're getting a question about the detailed icon. So anytime that there are details that are sent over, then we are displaying that information. If that information is not sent over, then of course we cannot display any information. So you're only seeing the information in which we receive from the facilities.
I have a question about the availability of an opt-out form in Spanish. We do have those. They're available on the web page. Also, there are informational brochures in Spanish as well.
Should be.
So we have a question about providers being able to see hospital discharge documents. So if that information is sent over to us, then yes, you will be able to see that information. So you'll go to the document section and you'll be able to view it within the CCD.
They choose.
We have a question about patients opting out. So in North Carolina, we are an opt-out state, meaning that patients are automatically opted in unless they choose to opt out. So there is a patient education opt-out form on our website, and it is the provider's responsibility to educate on the benefits of NC Health Connex. Just note that if your patient opts out, they are opting out of NC Health Connex entirely. So even if they just do not want one encounter being shown on the clinical portal, they're actually opting out from all encounters being shown. So if they show up at the emergency room and that emergency room doctor really needs to see the clinical information, that doctor would not be able to see that patient information.
They don't need to fill it out.
So if you are completing the NC Notify enrollment form, we do ask for, of course, the practice name, the provider name, and the phone number. That is just in case we need to reach out to you for any reason. We are not going to be texting you. So that's just for us to be reaching out to you in case there's an issue.
The Department of Veterans Affairs.
And then also a follow-up to the NC Notify. So we do know that there is a spot on the form as a future release for you to receive text notifications, but of course that is a future release. And then at that point in time, if you would like to receive text notification once it's available, you can actually reach out to us to provide your information. All right, we're getting another question about the education and the opt-out form. So it's only the provider's responsibility to educate the patients on the benefits of NC Health Connect. So you don't need to provide a form to them. You're educating on the benefits. And then, of course, if they would like to opt out, then they can go to our website and print out the form to send to us.
I see a question from someone indicating they contacted the support team but no answers. Would you please send us another email? We apologize if we hadn't gotten back to you. We have had quite a number of inquiries coming in. Email us again and we'll see to it that your question is addressed today. Thank you.
Another question that we had is about DSM. A provider or a PAA wanted to know if they had to be logged into the clinical portal to see the message. No, you do not have to be logged in. So you'll get like a tickler email that'll be sent to your other email that will state you have a message waiting for you. So then you can log into the clinical portal to view the message. Another question regarding the opt-out form. So no, the provider should not be sending in the opt-out form. It should be the patient that is sending the form over to us. We have a question about the data. So the data is near real time, but that also is based upon the connection type for each facility. We have a couple of questions about additional training for specific facilities or for your employees. So if you would like additional training, please reach out to us at hiea@nc.gov, and we can schedule something for you where we go out and we meet with your employees, maybe a lunch and learn, or we can also do another WebEx. So just reach out to us and we'll be glad to help set that up. And for this Teletown Hall, so within 2 weeks, this is, just as a reminder, it is recorded and will be posted on our website under the For Providers tab, and then you can click on Training and Tools, scroll down to the bottom, and you'll see the Teletown Hall recording. And as a reminder, the next Teletown Hall is going to be for participant account administrators. I'm going to go through what has changed and what you need to do to create portal accounts for users within your facility, and then how to request a DSM account, and then going through additional ways to enroll into the services. So digging a little deeper into the services and what you are required or responsible for as the PAA at your facility. And the next Teletown Hall is going to be on May 15th at noon, and that will be posted on our website momentarily. So I think we have answered most of the questions. If we have not answered your question, please feel free to reach out to us, hiea@nc.gov, or if you have a technical question, hiesupport@sas.com. And thank you so much for joining today. Hope you guys have a wonderful afternoon.
Thank you. Thanks, Jessica.